Hello, folks. How are you doing? Dr. Debbie, your mental health clinician. And as usual, I quickly want to touch base with you. And today, I just want to bring to your attention the word depression. You know, a lot of people they use the word incorrectly, like they mean like discouragement. They mean to use the word discouragement instead of the word depression. Depression is a mental disorder, so which needs the attention of mental health practitioner to be able to help. But discouragement, can be corrected by like motivational speakers. They just encourage you, like you are discouraged and you need someone to encourage you. That is discouragement. But I see a lot of folks there, even some people that supposedly to understand, but this is not an English word. Depression is a diagnosis. So people use it, oh, why should you be depressed? And at times, because of advocates for mental health that I do, I cannot stand it. Usually, I don't comment on people's posts, but when people are using that word at the expense of impacting the life of those that are affected with depression negatively, I always speak up for the vulnerable people. So I want people to stop using that word depression instead of the word discouragement. Anyone can be discouraged. Discouragement is just a momentary feelings, emotions. Maybe I'm discouraged because I'm expecting something. Maybe I'm expecting a flight. Maybe my flight was delayed. I can be discouraged. That's just a feeling. It's a temporary feeling. But depression is not a momentary feelings. It is a diagnosis, and there are a couple, lot of components that come into it. And at the end of depression, even we have two types of depression. It could be external, which is the extrinsic. It could be internal, which is very difficult to treat. We have the typical depression and the atypical. And whichever type of depression, we need medication, and the intervention of healthcare professionals, as I've said, psychiatrists, nurse practitioners, mental health professionals, practitioners, and medications. In some cases, even admission, because people do not see the reason to live. It's as bad as that. There's no one that will be discouraged and want to take their own life because they are not sick mentally. They are just discouraged because of what they are passing through. So please stop using the wrong word to mean the diagnosis. Discouragement, yeah, people are discouraged, people are not motivated, people want to take a break from whatsoever. But when people are depressed in the right sense, the meaning of depression, that's a mental health diagnosis. It is a diagnosis, a classification. We have group of symptoms that we look for according to Association of Psychiatrists, in the United States. And people should not just the lay people to mean when people are discouraged, they are depressed. Because you make the people that are depressed not to look for help. It's not that the people are lazy. They are going through terrible situation in their life. It's like somebody is having a stroke. You are not going to sit with the person that has a stroke, that is becoming paralyzed. Life is getting out of that person, to tell the person, oh, you are not thinking right. You are lazy. No, depression is always like all other life-threatening diagnoses that people should get attention for. And that is what I want people to know today, that stop using that word depression to mean discouragement. When people are discouraged, yeah, help your people, motivate them, encourage them. But when people are depressed, please help them to seek the mental health attention that they need, so that things will not get out of hand, so that they will not jump into the lagoon, so that they will not run into the moving vehicle, so that they will not take their own life. Because the symptoms of their depression is like them crying out for help, and people are not ready to help them. People are even making them to go deeper, in that state of depression. Thank you so much for coming my way today, and I know you learned something, the difference between being depressed and being discouraged, and I hope you will use the right word correctly. It's Dr. Debbie, your mental health clinician. Have a good one. Bye.